You're listening to episode 118, How to Get Your Kids to Take Medicine. Hello, my friends. I am so glad you're here today. This is a solo episode, so it is just me, Katie Taylor, here with the microphone today. Alone in my office. Actually, Winston, my dog, is here too, and I'm sure you'll hear him shake every once in a while. But this is going to be a quick episode about a topic that we talk about a lot in healthcare. I'm a child life specialist, which means we help kids and families cope with medical experiences both in and outside of the hospital. I wanted to come on here today because I have gotten this question so much in the past few weeks, and this topic happens to be one of our most downloaded resources on the website. So if you didn't know, you can go to childlifepodcast.com, now childlifeoncall.com, and get free resources. And this one just continues to be downloaded almost every single day by parents, by child life specialists. And so I thought that we could talk about how to get your kids to take medicine. We'll be talking about all the different types, from medicine and liquid with toddlers and how do you get them to swallow it, eye drops, how do you put them in kids' eyes without them freaking out, or pills. So swallowing pills is a big thing, and I've actually got a lot to say and some good techniques to share with you. So I'm glad that you're here, and let's get started. Okie doke. So first and foremost, whenever we are talking about helping your child do something, it's usually a big reality check that we actually have to help ourselves help our child. So what that means is that we need to get our butts in gear as parents, as a nurse, as whoever is the person who is administrating this medicine, and really check our own expectations, get rid of our own experiences that we've had with medicine, and separate that from what you're seeing now. The second thing is to realize that you are dealing with a child. This is not an adult or someone who is fully functioning and can determine that this medicine is very necessary for them to get healthy, for their, illness to go away, for something to maintain their life. It's really a lot harder for kids to understand the why of why they need to take medicine, because they're so consumed with what it feels like, tastes like, is like for their experience. So the reason I say this is because I don't know if y'all remember Dimetap growing up. There was like this grape Dimetap, and I will never forget how terrible it is. So every time I find myself pouring my kids a grape flavor, I have to stop myself from being like, good luck, this is disgusting. So I feel you on that. So step one is just to take a look at yourself, set your expectations up. Don't try to give medicine when you are upset or stressed or anxious. Make sure that you are good to go and ready for the experience. So much easier said than done, right? Because likely if you're giving medicine, your child really, really needs it. Your child has to take it in order to continue to be healthy, or to have a long and everlasting life, or to get rid of an illness. And so it's important that we know as parents, this is non-negotiable. So I know that goes without saying, probably, right? If the doctor wrote you this order, this medicine is non-negotiable. But I find a lot that as parents, we talk ourselves out of they probably don't need it. They spit it out, and so it's fine. They don't need it. And, maybe we can just stop now. But if your child has been prescribed medicine, understand that this is non-negotiable. So once you've accepted that for yourself, this is how we present it to our kids, no matter what age they are. I don't care if they are 9 months old or 9 years old or even 19. This is a non-negotiable thing that we have to accomplish together. Okay, so there's no part of this that is, can we take the medicine? Are you ready to take the medicine? Because the answer is yes, it has to be done. Step number 3 is to think about your child's developmental level and where are they at in their age about what they understand about the world. Do they know that they're taking medicine for maybe an infection? And have they been sick? Or are they taking medicine because the doctor thinks this is what their body needs to stay healthy? Is this something that the doctor... So what I'm trying to get at here is you need to determine the why for yourself, and then we can script it so it's less complex for kids to understand. So number one, you yourself, you're ready to go. You're calm, you're confident. Two, you understand that this is non-negotiable. So that is the attitude that we are going to present to our kids. So this is not a choice. We do not have a choice about taking medicine. Number three, the why. This is why we are going to take the medicine. It is not for fun. It's not because I just want you to, but this is not a choice that we have and we're taking it because of XYZ. If you have ever wondered where you could get those cloth dolls that child life specialists use with kids for medical education or sending home to siblings or to draw on for therapeutic activities, then you don't have to wonder any longer, because our friends at Smile Makers have decided to now sell these amazing cloth dolls for a very affordable price. I know that when I was in the hospital, I would have to rely on a volunteer network to then give us the dolls, which was really nice, but I had to wait a lot of times. Like I would need a doll now and I wasn't able to get it. So this is a great place to be able to go get your procedure dolls at smilemakers.com. And y'all, they have 3 different skin tones for these cloth procedure dolls. In addition, you can actually buy a procedure doll prep bundle that comes with fabric markers. This is a fabulous way to do your medical teaching, to help siblings feel involved, to get kids creative, to do a lot of teaching about different diagnoses. And so go to smilemakers.com so you can get your cloth dolls as soon as possible before they run out. And when you go to that checkout to get your cloth dolls, also type in OnCall20 and you will get 20% off your entire order. So not just the cloth dolls. So if you get a bundle for Child Life Specialists, if you get a piece of furniture, if you get one of their really cool toys and prizes, or you order a large sticker order from them, OnCall20 gets you 20% off your whole order. That's smilemakers.com, code OnCall20 to get 20% off. So we have kind of just done 3 things to this child, your child that you're giving the medicine to, and we have taken away a lot of options for control. So they have to take this medicine. They don't get to choose the flavor. So what choices can they make? And one very simple choice that we can give is, how do you want to take this medicine? So we can take it in a syringe, and that's like a squirter. You can call it a squirter if you want. We can take it in a medicine cup. We can put it in a real cup. You push the medicine. We can have mom, we could have dad, we could have grandma, we could have the nurse, we could have the child try to push the medicine in their mouth. We could take a sip of water beforehand or afterwards. We can eat an M&M when it's done. So there are some choices that kids can make, and we need to empower them in this experience too. Even though it is non-negotiable, they don't have a choice about that. They do have a choice about some of the inner working things that happen to actually get them to take the medicine. Okay, step 5. This is when we move into the practice zone. So for liquid medicine, there's not a ton of practice that has to be done with this, other than just really getting your child to feel comfortable with, if you're using a syringe, that they're not identifying it as an object that's more threatening than it actually is. One way in my house we do this is we just keep syringes in the bathtub for the kids to use as squirters. So they're no longer, just about giving medicine. They're actually about play and bath time more than they are about anything else. So when it comes time to squirting, they're really comfortable with it. It's a non-threatening item. That's a good thing. Now, when we're talking about giving eye drops or pills, that's a little bit of a different story. And I'm going to talk about doing eye drops first. So it's so funny. There was just this reel that came up on my Instagram page the other day about when you're sitting in the eye doctor and they put that puff of air and it's coming and you're freaking out. So we as adults know that experience, and of course, our children are going to have that same reaction because they don't even understand fully about what the drops are going to do, what they're going to feel like. So the more that we can practice and talk about what it feels like, the better we're going to be off. Here are 2 strategies for helping your kids with eye drops. The first one is just to literally show them that it's a liquid. Okay, so literally put a little drop onto your finger, let them feel that it's water. Okay, so that it's water, it's not anything that's hard or sharp, and there's no misconception there about what it actually is. Feels like a liquid, it feels a little bit cold. The second thing is to literally get like a baby doll or draw a sheet of paper. Even you don't have to use a doll, just draw 2 eyes on a sheet of paper and show them exactly where in your eye you're going to put the drop. So your optometrist or your ophthalmologist or eye doctor may have an idea about how you should give these drops. We've had a lot of success in the hospital when we don't do them from far away. So it's not like a big drop that's coming into your eye. It's a tiny little drop that you put in the corner, and then you encourage your child to blink it into place. That way you're ensuring it actually gets in the eye. When it comes to talking about pill swallowing, so child life specialists will tell you that this is one of the haunting things. And I don't know, I actually like teaching kids to swallow pills. It's usually that the stakes are high and we are consulted by a doctor within 6 hours of discharge of being like, this kid needs to learn how to swallow these huge horse pills before they get out of here. And by the way, they're 5. So 5 years old. So typically, we're just kind of have these funny experiences where we're put in really difficult situations because swallowing pills is not something that should or does come naturally to a lot of kids. It's something that takes progress and practice and patience. And so let's talk about those 3 things with pills. So the first thing is progress. I have a friend and her daughter is needing to take daily medication in a pill form. And when she is 6 years old, so we have started with this strategy of using really small pieces of candy to get her comfortable with swallowing. And when I say small pieces of candy, I'm talking nerds, like one tiny nerd. Go to the store, let her pick out what color nerds she wants. And we want her to get really good at swallowing nerds. So it's like no big thing. And every time she swallows one, we make a big deal about what a big girl she is, that she was able to swallow it. Wow, we're so impressed. We can even put a little sticker on a chart that says, yep, I did the nerds. After she is incredibly successful at swallowing this tiny little piece of candy, the progress starts to move up. Okay, so it becomes a process now of swallowing bigger pieces of candy. Ideas are Skittles or Tic Tacs or Mike and Ike's as just different ways that you can continue to gradually, very gradually at your child's pace, swallow different sizes of pills. Now, your kid needs buy-in to this, right? They have to be an active participant in wanting to swallow pills. So the more fun you can make it, the more choices you give, the better off you're going to be. Eventually, after they have had a well-established routine with swallowing this candy, then you can start to transition them to the actual pill. And when you're doing that, we continue to have this great roar of approval and excitement around trying, not necessarily being successful, but about attempting and trying. And if you remain patient, the last part of this process, and your child remains patient, and this is started off on a really fun, this is like an activity, something cool I get to do, like maybe I get to eat the candy after I'm done trying with it, then this is going to be something that your child wants to be successful in. So we've talked today about being calm yourself as the parent, to recognizing that this is non-negotiable. This is just not something that we can say no to. We have told our kids the why as much as we can to what they can understand at their age and development. 4, we have given choices. And 5, we have practiced in whatever way we need to. So I hope that these tips were helpful. I know it's not easy out there trying to give medicine to kids, but it is important. And the more we can set them up in a way that is positive, the easier time you're going to have and they're going to have with medical experiences further down the road. All right, guys, thanks for being here today, and I hope you have a great week. I'll talk to you soon. Bye. Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/childlifeoncall, and you can listen to more episodes and find resources at childlifepodcast.com.